falling asleep. Come on. Hi,
Okay,
Dr.
hi,
How are
Kobi.
you?
Very fine.
Nice to meet you.
Nice to meet you too.
This is Tyrion.
Ah, Tyrion.
He's just having so many issues this morning.
No problem.
Yeah.
We'll have a look at him.
We've just gotten a collar for him, so
Okay.
he's not very used to it.
Okay.
Yeah. So,
That's understandable.
Thank you.
Okay. So hi, Tyrion.
Say hi. I
Come
wanted
on.
you to meet him so that we can get him checked.
Okay.
We can get, I guess, his shots done.
Okay.
And you can tell me a little bit about his health.
Okay.
And generally, not just about dogs, but I think today what we want is to just cover all pets, all animals, see what we're doing right, what we're doing wrong.
Okay.
And just to demystify a lot of these issues.
Okay.
But he's going to be our star of the show. Tyrion, say hi over there.
Say hi.
Say hi to everybody.
Hi.
He's a really nice dog, guys.
I see that, and he likes
He's such a
me.
nice dog.
And he
Yes,
likes me.
he's a nice dog.
Okay.
He's really lovely, and he's got a crazy birthmark. Do you guys see that? My friend called him the pirate. He's not a pirate. He's just it's just his birthmark. And this is the reason why I got him.
Okay.
And he's teething.
Yeah.
Which means that he's biting everything.
Okay.
So you can tell me how to stop that too.
That's fine.
Okay,
Absolutely
great.
fine.
Do we have a place?
Let's pick a record.
Okay.
And then we can go to the consultation room.
Fantastic, Tyrion.
Okay.
That has given a lot of education.
Okay, so let's go into the consultation room and have a look at Tyrion.
I think this dog knows.
Yeah.
I think he knows where he is.
Yeah.
Because he's so anxious. Normally
But
he's running around and playing.
okay, they always do that when they come to the vet.
Yes.
But they eventually get used to it.
Okay.
And some of them become very good friends of ours.
Nice.
Yes. But basically, it's good that you've come.
Yes.
Because health checkups are important, just to make sure that they are okay.
Yeah.
We need to do basically the vaccinations. We need to deworm them.
Yes.
We need to control the ectoparasites, so the fleas, the ticks, because they can cause very serious health problems. So, how old is Tyrion?
He's 2 months. Well, let me be honest. When I bought him,
Okay.
and listen, a lot of people were thinking, how did I end up with a puppy? I'm so busy.
Yeah.
But it was just a situation where I saw him, one
Okay.
of those guys on the roadside.
Okay.
And he's got that cute birthmark. And so I asked about everything, his
Yeah.
vaccination, how old he is, and the guy said he's 4 months.
Okay.
But a very good friend of mine who knows dogs very well came over
Okay.
and said that he can't be 4 months.
Okay.
That they think that he's 2 months at most.
Okay.
Yeah.
Sawa. Did you get any vaccination record, anything?
They said he was vaccinated, but I think that's why I decided to come here.
Okay.
So I can hear from a professional. Has he been vaccinated? Should we vaccinate him? And I think he needs to be.
Okay.
Yeah, he needs to be. Because the guy didn't give me a card.
Yeah.
Yeah,
Because
but
and that's a very important thing, by the way.
Yeah.
If you're looking into getting a dog,
Yeah.
you must get you can get a dog from a credible person, or if you get a dog, make sure you also get the history, which comes in form of a record.
Yeah.
Not the vaccination and deworming. Yeah. So, but that's fine. So what I'm going to do is basically do a quick checkup to just make sure the Tyrion is fine.
Yeah.
Because again, we cannot vaccinate a dog when it's sick.
Okay.
Okay, that's very important to know. So it's okay there. I just want to see your eyes, and I like your pirate eye.
Down.
There you go. It's
Pirate.
okay. It's okay. It's okay. That's fine.
He's crazy, by the way.
It's expected in puppies.
Really?
Yes,
Oh my
yes,
gosh.
yes. They are always playful.
Yeah.
So, but again, as you're saying, some behaviors, they also bad behaviors.
Yes.
They tend to learn when they're young.
Exactly.
So it's very important, like, he's trying to bite my hand and everything. That's not a good thing.
No.
But again, it's understandable because at this stage is teething. Yeah?
So he's looking for anything to bite on.
Anything to bite to just make him comfortable. Yeah?
Funny thing, he knows
So
not to bite me.
let me listen to your chest. There you go. There you go. Okay. Okay. So feels
He's growing
fine.
very fast, I have to say.
Yeah, what are you feeding him on?
I've had issues with his diet.
Okay.
Sometimes he refuses to eat. Sometimes but basically, I give him it's puppy like meat.
Yeah.
I think it's got some worms.
Okay.
And a bit of rice.
Okay.
But I think the reason he's gotten so fat.
Yeah.
We're so fat, Tyrion, is because I read somewhere that this type of dog has probability of getting sugar problems.
Yes.
Blood sugar problems.
Yes.
And so when they're young, feed them 4 times a day, and I think I overdid it.
Okay.
So yeah, 4 times. It's supposed to be 2.
4 times is quite on the higher side. In fact, we should be looking at feeding a dog once per day.
Really?
Okay. But again, when they are young, because their energy requirement and the protein level in their diet is, they require quite a lot.
Yeah.
So it's very important that you also, as you're trying to balance the number of times that you're feeding, you bear that in mind, that they are growing fast, the nutritional requirement is also very high. Yeah? Okay, so let me feel your abdomen. Okay.
Can you tell when an animal is sick right away?
You can.
Really?
You can. Actually, I usually tell our clients that the first thing that a sick dog will do is basically to go off feed, to look a bit depressed. Yeah.
Oh, okay.
So those are early signs that the animal is not feeling well. Like Tyrion is a playful puppy.
Yes.
So if
One day he's sitting like this.
tomorrow you found him a bit dull and not, wanting to play, not feeding, that's an early sign that something is wrong. And the thing is, the earlier you bring an animal to a vet, the better. Okay, so don't wait until the animal is too sick to seek medical treatment. Okay, I think Tyrion looks fine. So what we should do is go ahead and do the vaccinations and deworming. But probably I should tell you, there is a regime in terms of how we do the vaccinations. Okay, so we start vaccination at 6 weeks. We repeat, that's what we give at that point is called a parvoenteritis vaccine. Okay, it's a viral disease that basically tends to affect puppies a lot. We repeat that when they are 9 weeks old, and then at 12 weeks of age, we do a full vaccination, which is a cocktail of 5 vaccines. Okay. Now that Tyrion is 2 months old, that's basically about 8 weeks. So I would recommend that we do a second parvo injection, and then you have to bring him back after 3 weeks, so that we can do a full vaccination. Okay, it's going to be fine. Okay, yes, but I'm happy that the coat is clean. Yeah, it doesn't have any fleas.
Oh, good. He's really filthy. Actually, I need to explain that.
Yeah,
he's usually sparkling white. This is because he made new friends who are just licking him and throwing him in the mud.
Nice.
Some other very big dogs. But usually he's proper clean. Aren't you? And we're going to take you there after this.
Yeah, and you like it.
But there's a lot of quacks out there, would you say? People who are operating outside of their professional know-how. Would you say that?
Exactly. You're 100% right. There are a lot of quacks outside there. But it's very easy also to know a credible person. We have a Kenya Veterinary Board. So if you would want to know somebody's credentials, you can just call the Kenya Veterinary Board, and they will be able to respond within a very short time to tell you whether that person is qualified. The other alternative is there are already established clinics which have been known to work to be in practice for quite a number of years. And this is such an example of such a facility. So I think that's a nice way of just getting to know whether a person is really qualified. Because that's very important.
Absolutely.
Okay.
All right. So. As we of course ponder that, he's about to get his shots. Doesn't look very happy. I feel like dogs know stuff. Animals know things. and more than we give them credit for.
Yeah.
Right?
Yeah.
Okay, so as we are pondering all of that, a lot of people fear, especially dogs, and especially the big ones when they bark. A lot of people fear being bitten, and dog fear and animal fear is real.
Yeah.
And so today I want to teach you a few things that you didn't know about your fear of animals and how to slowly get over it. Take a look at Did You Know? There you go. You don't need to fear animals, okay? I don't think God made any mistakes putting us on this planet with all these beautiful creatures.
Yeah.
You know?
Yeah.
I mean, there's some crazy people, Dr. who have tigers in a New York apartment. We're not those people.
Yeah.
But I think fear is something that we should try and overcome.
Exactly.
Or avoid the animal altogether.
Exactly.
Right? So you're going to give him the shot?
Yeah, so as I was telling you, the vaccine need to be stored in the right manner. So it need to be refrigerated at a certain temperature. So what we have here is the vaccine that Tyrion basically needs for now.
Okay.
I'm just going to give him a shot.
There's a lot of dogs here, I can hear.
We have a lot of dogs.
Yeah.
As I was telling you, remember this is one of a bigger facility in terms of veterinary care in Nairobi. Okay. And we are also a training institution.
Right.
Okay, so we tend to get a lot of referral cases, and also just our clients like yourself.
Yes.
So, and also we have some dogs that are here basically for, you know, somebody found a dog outside there and it was injured. So we don't let the dog feel pain. So we just come, brings the dog here and we treat as such. Okay? So that's the medication. It's ready for injection. Tyrion, I'm just going to give you a little injection of the skin. Yeah, there you go. You see? You're such lovely. Exactly, I'm shocked. So actually, you know, it's most dogs actually
don't mind it.
Don't mind the injection.
Really?
And the other thing is the vaccine is not painful as such.
Okay.
It's only that there is a bit of discomfort because of the fact that it was refrigerated.
Of course.
Okay?
Now, Dr. I wanted to talk a little bit about some of the dogs that you find here.
Okay.
On our way here, we saw a dog that's very, very hurt on the head. He's got a huge scar. Okay. Tell me a little bit about that dog and the treatment for a dog like that.
That dog is a crossbreed male dog. Was cut by an iron sheet yesterday at night.
Okay.
And this is a very common thing. Injuries are very common. It's one of the things that we treat oftenly here. Okay. The thing is, as I was telling you, immediately you notice an animal is unwell or it is injured, bring it immediately to the clinic, okay? So for example, we would have stitched that dog, but again, the wound was badly contaminated. Meaning if, for example, now you went ahead and stitched it up, you'll basically causing a lot of infection in the wound. So what we do is basically manage the wound as an open wound for probably 2-3 days. And once you clear the contaminants and the infection, then you can be able to stitch it up.
Okay.
But it's a very common thing. We get dogs with fractures and everything, okay?
Another thing I think that I really want to talk about is the cost.
Okay.
A lot of people feel that, you know, it's costly. What can you say about cost?
Let's face it, that
there's a cost to it. This is not free.
If you're getting a dog, you have to bear some cost. There is a cost to feed the animal. There's a cost for veterinary treatment. There's a cost. It's actually contrary to what people tend to think, because we have had, you know, people tend to think that pets are kept by the whites.
Yes.
So immediately you see somebody like Kobi with a dog, you think this guy has a lot of chums. But contrary to that, it's not expensive. For example, if you were to do, you know, the injection we've just given, it's just 1,000 bob. And then the full vaccination will cost about 3,000 bob. And that 3,000 bob is for a whole year. Okay, you can imagine just deworming a dog is about 150 bob.
Okay.
So
yeah,
it's relative,
reasonable.
it's reasonable
Yeah.
according to me.
Absolutely.
And then the value that it adds to an animal in terms of its health is not comparable to the cost.
Absolutely,
Okay,
yeah.
so then the other cost is of course about feeding.
Yes.
It depends.
Feeding is not crazy. It's not. I'll tell you what. I feed him about a can.
Yeah.
And that can lasts a whole week.
Yeah.
And it's 130 bob. It's 130 shillings and rice.
Yes.
And I've got a big bag of rice, just a little bit of rice. It's not crazy. I thought it would be so crazy. It's not.
It's
and
not.
considering I'm overfeeding him,
Yeah.
my cost will go low.
Will go low, exactly.
Yeah.
So it's I want to demystify that myth.
Yeah.
That
I'll tell you how much I've spent so far on food. Can
Okay.
I just be honest?
Yeah.
I've spent 3,600 in the month. In the month and a half I've got him. I mean on everything. That's toys. I'm talking to you about like everything. Toys,
Okay.
Nini, easy to sort it, this leash, the collar. It's 3K. Great, Dr. This has been amazing. Very enlightening indeed.
Thank you so much.
Why did you decide to become a vet?
Oh, I've been raised in a family where, you know, my parents were farmers.
Yeah.
Okay, and as a small boy, I used to walk around and see, you know, people grazing their animals.
Yeah.
And I remember at one particular time, our cow was very, very sick. And definitely for you to access veterinary care back in the rural area is not very easy. So I watched my uncle and my mom trying to, you know, get those herbal medications to treat the animal. And interestingly, it recovered.
Really?
From that time, I said, I want to become a vet.
So you can heal animals.
I want to do something both to my community and to myself.
That's
okay?
amazing.
So that's why I decided to become a vet.
Okay.
It's something that I'm very passionate about.
Yeah.
I always look forward to another day of, you know, getting an animal feel better.
Well, today you have a brand new friend. Okay,
Yes.
Tyrion, Dr. Willy is now your friend,
Yep.
okay, and he's your doctor,
Yes.
and you're gonna live a nice, healthy, long life. Asante, Dr.
Thank you so much,
Thank you
Kobi.
for inviting us here, and thank you for allowing us to get into your life and into your practice.
Anytime,
Asante sana.
Kobi. Thank you
All
so
right.
much.
It's our pleasure.
Asante.
All right, everybody, there you have it, dog health. Okay, we take a very quick commercial break. And as we do that, we're taking him to Pet Paradise. So he can get cleaned, so you can really see him in his full glory. All right, everybody? Today it's all about animals. Remember to connect with us on our social media platforms. NTV, hashtag NTV Better Living is how you can do that. Better Living KE is how you can find us online. Take some pictures of your pets, your lovely animals. Send them to us. We'd love to share them.